In England, free universal health coverage is provided by the publicly funded NHS. However, you can also choose to pay for private care. You can buy private medical insurance as an individual, or you may receive a private insurance package through your employer. You may also opt for self-pay. This means you choose not to be insured and instead directly pay for private treatment out of your own pocket. Hospitals normally charge self-payers a lot less for a treatment than insurance companies. When you get private medical insurance, or PMI as it's known as, you have the choice as to whether to use your private plan or use the NHS. This means you are still always entitled to NHS care for free, and as you will see later, you will still need the NHS in some cases. The NHS, however, cannot pay or subsidize your private treatments. One of the main reasons why someone may seek private care is to obtain fast-track appointments and avoid long waiting lists. Although keep in mind that with very serious illnesses, you will not necessarily receive treatment more quickly with private insurance than you would under the NHS. Another reason is to obtain a degree of choice when it comes to where, when, and how you are treated, which is not always the case with NHS when choosing a specialist or hospital. Again, keep in mind that this doesn't necessarily mean you will have unlimited choice under private insurance, since you might have to choose from a list of hospitals or consultants in their network. You may also want to choose private care because you prefer your own private room in hospital. Depending on your private insurance policy, you may be covered from initial diagnosis and consultation through to treatment and aftercare. More comprehensive policies will offer more coverage. Your first point of contact, however, will always be your GP through the NHS. So if you became unwell, you would visit your GP, and if they are unable to diagnose you, they would refer you for further consultation. At this point, you can continue on the NHS path and be referred to an NHS specialist, but if you are covered for consultation and diagnosis with your insurance, you can continue on the private path. Your private insurance will then ensure you are seen by a specialist as quickly as possible. Check if your insurance company accepts consultant referrals from GPs. They usually will, but if your insurance has its own list of consultants, simply ask your GP for an open referral. If you choose to continue with private treatment, you will receive treatment in a private hospital or in the private wing of an NHS hospital, since NHS hospitals often have private patient units now. If you've had a private consultation for tests and diagnosis, you can still receive treatment from the NHS if you are then referred on to an NHS pathway by your specialist. Some policies have an add-on which would give you an allowance to see a private GP. Each policy is different, so remember to check carefully what is and isn't included. It's important to know that private medical insurance is not a replacement for all NHS services, especially in areas that cannot compete with the NHS. Also, private insurance primarily covers necessary treatments, not prevention services or routine checkups, and it is designed to cover only curable short-term medical problems. Therefore, the NHS will offer free treatment for anything medically necessary, whilst all private insurance policies have exclusions, which are treatments they will not cover. The most common exclusions in private policies include pre-existing conditions for which you were previously diagnosed or have shown early signs in the past, long-term chronic illnesses that cannot be cured, pregnancy and childbirth, as well as accident and emergency services, since the NHS is quite comprehensive in these areas. You will likely find a whole list of other exclusions, which may include substance abuse, experimental treatments, cosmetic surgery, and so on. Check with your insurance company to find out what their exclusions are. If your private insurance cannot cover an illness or there are complications during an operation, a patient can be covered by the NHS. The cost of private healthcare really depends on the policy you choose. There are now many insurance policies to choose from, including specialist policies, mix and match products, and lots of add-ons for extras in preventative medicine. Coverage levels vary, and typically the more you pay, the more coverage you will receive. Your age and state of health will also impact your premium.